control the disease without resorting to whole-scale lockdowns. Although we have implemented some level of moderate physical distancing, public services and businesses remain open and no movement restriction within the country have been imposed. As such, this combination of targeted approaches can be a useful way forward in the months ahead. Adopting a phased approach to de-escalation and leveraging technology for swift contact tracing could be a viable strategy to sustain the response to COVID-19 pandemic. We stand ready to work with WHO and the global health community on this important issue. Thank you.
Thank you.
Señor Presidente.
Distinguished President of the WHA, Member States, WHO Director General, this year's assembly is taking place in an extraordinary context, and everybody needs to pull together to face up to this pandemic, which means that we need to rethink our healthcare systems and rethink the reintegration of our peoples. We in Paraguay have taken drastic decisions very early in order to combat the pandemic. We recently experienced a dengue epidemic, and therefore the healthcare system was extremely fragile anyway and involved in a reform process. But we focus on the value of life, and current figures show that the decisions that we've taken have been the right ones. But the situation is extremely difficult. We need to emerge from lockdown gradually, and we need to use intelligent, smart quarantine. We need to ensure that we don't make mistakes at this crucial time. The people of Paraguay has supported the government in this approach and is promoting a new series of lifestyles. And what's absolutely vital is that all stakeholders are involved. We need to include prevention as well as efforts to combat the pandemic at borders. We need to ensure the full